Hi, my name is Christy Call, Editorial Director of Cure magazine. In this edition of the Speaking Out video series, on behalf of the National Pancreas Foundation, we're talking with Dr. Eileen O'Reilly from Memorial Sloan Kettering Cancer Center about pancreatic cancer prevention. Hi, and welcome.
Hey, Christy. Thanks for inviting me here today.
Anytime. So when we talk about prevention, can you maybe just discuss some of the non-genomic risk factors that are associated with pancreatic cancer that we should kind of watch out for?
So prevention is a very, very important topic in pancreas cancer, and it's probably the biggest public health message that we need to consider for this disease. So the things that are personally in our control that can individually reduce our risk of developing pancreas cancer are the lifestyle considerations. So diet, for all of us, eating a healthy diet, low on the fats, on the discretionary simple carbohydrates like sweets, sugars, cakes, and biscuits, low on processed food, not over short periods of time, but over long periods of time. That impacts our risk of developing pancreas cancer. A major public health message is no smoking. We know a lot about smoking and pancreas cancer, and it probably accounts for a quarter to a third of the incidence of this disease. And so a person in a family who has pancreas cancer, they're an advocate now for this disease, and we counsel them to advise their family members and their friends to not to smoke. And that's not to imply, of course, that everybody smokes who has pancreas cancer. That's not true at all, but this is a reversible factor. And the good news is, for the most part in North America, that smoking trends are down, but there are some groups and younger people where we're starting to see an uptick on this again. So the third major area to keep in mind is keeping a healthy weight. And this goes back to diet, but it also factors in terms of exercise. So diet, exercise, nutrition, and not smoking, and minimizing excessive alcohol consumption, also an important factor. We know that a small amount to modest amount of alcohol probably does not alter the risk of pancreas cancer. But these other factors do. And undoubtedly, some of the rise in the incidence of pancreas cancer that's been observed in the last few decades is related to these lifestyle considerations in parts.
Okay. So I want to kind of delve a little bit further into the diet aspect of things. So, how does nutrition play a role? And do you have any recommendations for individuals to try to improve their diet? To try to prevent this disease?
Yeah, so it's hard to be absolutely specific about this, but the recommendations that we encourage and counsel are what's recommended for all of us. So fiber, fruits, vegetables, again, low on processed food in terms of meats and otherwise, lower on red meats, simple sugars, sweets, cakes, biscuits, to minimize those, and to keep the fat content ideally is polyunsaturated and less animal fats. So putting all of that together is likely to be, again, important over extended periods of time. And so developing those habits when children are young that they bring with them through their life is undoubtedly going to impact on the risk of this disease. And it's not that one can show this on an individual basis, but when you look at large populations of people, we know that this is important. And some of this we've learned from studies for people who grow up in other countries and then adopt a Western lifestyle, and their risk of a number of diseases changes because of that lifestyle, which is often factored around diet and exercise considerations.
Okay, and then similarly, so with diet, there's exercise. So what role does exercise play? And are there any examples that you can give on what individuals could be doing in their daily lifestyle to kind of try to prevent this disease?
Yeah, so again, we don't have a lot of concrete data, and I think it's factored into diet, but as a general health guidance, we're all encouraged and counseled to get our heart rate up at least 3 times a week for 30 minutes of activity. And I think we're all challenged to improve ourselves. So I love the idea of patients having Fitbits or healthy family members having Fitbits to measure their activity on their iPhone or other measures to encourage steps. It's a nice way of measuring it, and people can relate to that very readily. And so encouraging those types of trends, and again, for younger people to encourage these physical activity on a regular basis from a young age is essential, and to counsel people against a sedentary lifestyle.
Definitely. And so I know you mentioned some other lifestyle changes like the smoking and the drinking. Are there any other types of changes that individuals should consider when it comes to reducing their risk of pancreatic cancer?
The other major considerations would be in a genetic context for this disease. If a healthy person belongs to a family where pancreas cancer is present, and either there's one or more family members who have this disease, or there's a known genetic background. So for example, some genes part of our DNA, which is changed, can increase our individual risk of developing pancreas cancer. And the common genes there would be BRCA1, 2, known for their association with breast and ovary cancer and prostate cancer in men, but not so well known, but associated with pancreas cancer as well. And that has an impact in the treatment aspect, but it also has impact in the prevention setting, because we will recommend for families where a healthy person carries one of these genes that's altered, that they may be considered for screening to try to individually reduce their risk of disease. And the other major kind of sort of lifestyle consideration is a person developing diabetes. In particular, diabetes associated with weight loss is a concern. And if they don't have a body habitus or lifestyle that might suggest they might be at risk, that further raises the concern, and that they may be people that need evaluation, and very specifically to look for pancreas cancer. Now, most will not have pancreas cancer, but that's a subgroup where there's focus on an early detection strategy. And we know that early detection is going to improve outcomes for this disease. And that's one way of, on a perhaps slightly broader population basis, thinking about groups of people that might be at higher risk of this disease.
Mm-hmm. Yeah, so in trying to change lifestyles and have early detection and make sure that we're preventing this disease, how can we try to help to raise more awareness around these issues so that we can prevent pancreatic cancer?
So thank you for asking this. It's again so important, is just public awareness and education, and that's the really key role that the National Pancreas Foundation plays in terms of awareness, education, and providing resources for patients and families and interested public who just want to learn more because they've been touched in some direct or indirect way related to this disease. So yes, and I think dedicated research dollars are how we get more people focused on this disease and how we improve outcomes. So it all is very, very key, and perhaps relative to other malignancies, we haven't had as many public figures who've had pancreas cancer speak to the importance of advocacy and education and awareness. So even more so in this disease setting, I think organizations such as the NPF are critical.
Absolutely. Well, thank you so much for joining us today.
Thank you.